For community or clinical setting, we're going to try to identify where exactly our sample or participants were collected from. First, we have to discern whether it is from a community or non-clinical setting or whether it's from a clinical setting. A clinical setting will be a mental health setting, such as receiving therapy, counseling, mental health treatment at a rehabilitation center, and so forth. A community or non-clinical setting will be any community level organization, institution, or grouping that we can take out of the sample description. This can be anything from school setting to hospital and so forth. Let's go ahead and take a look at these subsets. For our article, it's pretty easy to figure out. We just have university students. A lot of other studies will take students from public or private school settings. Sometimes you'll have medical or hospital setting. You'll interview family members of a patient who's getting treatment. Maybe they'll interview nurses or doctors to study that way. Legal criminal setting would be something like interviewing inmates or looking through county records at divorce records and then trying to contact divorcees and interview them. A mixed setting would just be a combination of any two of these specific settings. If we do have a nationally representative data set, sometimes it'll be a secondary analysis that'll come through data that the government or a larger research organization has already collected. In this little box right here, we're just going to input the actual name of that data set that is provided. Right here, for an example, we have the National Survey of Families and Households that is provided. Sometimes a survey will have a specific year provided, or multiple years will be provided, and you'll have to indicate that in the box. If there is another type of community sample on a community local level, then we need to try to identify which in this box if it doesn't fit in these categories. A lot of researchers will use mailing addresses to randomly select research participants in a specific zip code or use random digit dialing in a certain area code. Samples can be obtained other ways, such as members of some local government institution or any area local club and so forth. We'll just go ahead and look back and show you what the clinical subtypes will be. It's similar, so if we have a specific data set that the researchers used, we'll type it here in this box. Then we'll just have to try and identify which of these settings match our research participant setting in the article based on how the authors describe it. If you have trouble with this, just ask your TA.